finish with an appropriate response. So while everyone's getting their questions ready, so first come, first serve. So form an orderly queue. I will talk about the questions that have already been asked. What's that? Save draft. And so I'm going to start with this one, which was someone on YouTube has. It's going to start making noises on TikTok. I tried to get TikTok on my computer, but the webcam was rotated and I couldn't de-rotate it. And I know that sounds like a basic thing, but trust me, I know computers. Okay, I know what I'm doing. I know my way around. Yeah, I know my way around the settings of a webcam. Yeah, and I couldn't do it. So so if a man of my caliber couldn't do it, then God help the rest of the population. Anyway, so this is a question that's come from from YouTube. I'm watching this so watching this meaning, I think it's a video about, about inverted nipple correction. I'm watching this while I'm pumping milk to feed my baby. I've never realized I have an inverted and flat nipple until I had to breastfeed. I'm considering to do the surgery before my next baby so I can properly breastfeed. So that is a reasonable thought, but it is an erroneous thought, because if you have an inverted nipple and you are able to express milk from it, albeit quite difficultly, or with difficulty, is probably a better way of saying it, then you're better off not having an inverted nipple correction, because if you have an inverted nipple correction, the best way to treat an inverted nipple is to cut the milk ducts, because the problem is the milk ducts are shortened. So the best way to treat an inverted nipple is to cut the milk ducts, which means you will not be able to breastfeed. So if you're able to express breast milk at the moment and you're thinking of having another child, I would say you're better off having the other child and finishing your family before considering an inverted nipple correction. There is a way to correct an inverted nipple without cutting the ducts, but I don't do it anymore because I don't find it's very good. I don't find it everts the nipple very well. It keeps it tethered. It's quite hard to do, so I actually don't do it anymore. But there might be people out there who still do it, so they might be able to help and do it. But in my experience, it doesn't do a very good job. So I would say you're better off waiting till you finish your family before you consider having an inverted nipple correction, at least the way I do it. You could look at maybe having it corrected by keeping the ducts intact, but it's always a bit unsatisfactory, I find. So I can understand why you think you want to have it done before your next baby, because you'll be able to breastfeed better, but you'll probably be able to breastfeed worse after inverted nipple correction. So don't do it before your next baby is my advice on that one. Why does the stuff inside my cyst smell? Is this down to poor hygiene? No, it's not down to poor hygiene. It just smells. There's a certain smell of a cyst. And you don't normally smell it because it's usually in the cyst. You might smell it if you're having it removed and then we sort of breach the wall. But you don't normally smell it unless it gets infected and the stuff starts coming out, in which case you might smell it, which kind of might be due to infection. So it might be, but it's not due to poor hygiene. The stuff inside a cyst is sebaceous material because it's just collected in that cyst, and it's this sort of white cheesy stuff which has been sitting there, and it just doesn't smell very nice. So it's nothing to do with you or your hygiene. It's just to do with the cyst. All cysts, no matter how clean or how unclean you are, your cyst contents will smell. So and that leads me on to what is a cyst and why do you get them. So a cyst, strictly speaking, is kind of like a epithelial lined sac or something. It will be kind of like the sort of definition of a cyst. It's just like a sac basically. And there are obviously, maybe not obviously, but there are cysts all over the body. You can get cysts. You can get cysts in the brain. You can get cysts in the bowel. You can get cysts in the stomach. You can get cysts in the pancreas, in the ovaries. So you can get cysts everywhere, epididymal cysts. So anyway, so I'm assuming what we're talking about here is skin cysts, which are sebaceous cysts, epidermoid cysts, pilar cysts. So these are cysts within the skin, and sebaceous cysts are caused by the hair follicles being blocked, and the hair follicles, there are hairs all over your body, and so they can happen anywhere. Sorry. So you can get cysts anywhere in your skin.
TikTok just dropped the prices on these tablet bundles. It's a complete tablet set with a blue.
So you can get cysts anywhere where you've got hair, which is basically anywhere on your body, and the follicle gets blocked, and so the sebaceous material that the gland produces to nourish the hair gets blocked and collects, and it forms a lump, basically forms a swelling. They're nothing harmful, they're nothing to worry about. They are a nuisance, they can get infected, they can burst, they can cause bother. And so if they are bothersome, or you just don't like the look of it, if it's very big or uncomfortable, then you can have it removed, and the removal involves removing the cyst wall. And that's why you need to do surgery on it, because if you just try and burst it or put a needle in it and get the stuff out, the cyst wall stays and it just recollects with this sebaceous material. So it's kind of like a short-term benefit, and in fact it might introduce infection and stuff. So it's not a good idea to try and put needles in, as tempting as it may seem. So yeah, the best way to treat them is to actually cut them out, but it does cause a scar. But as I say, you don't have to treat them. If you've got a sebaceous cyst, a cyst in your skin, and it's not causing you any bother, you can leave it alone. Although, as I say, they can get bigger or burst or get infected. But if they're not doing any of those things and they're not particularly bothering you at the moment, there's no kind of urgency to remove it, because they're usually benign and kind of nothing to worry about. One of my breast implants is higher than the other 6 months after surgery. Is this normal? I don't know who's asked this question. I don't know if it's a patient of mine, because if it's a patient of mine, then I would say, yeah, let's have a look, see what's what. I wouldn't say it's normal. I wouldn't go so far as to say it's normal. Normally 6 months, you're sort of getting along the way. 3 months, maybe, within the first 3 months, maybe. So if it's higher than the other 6 months, I would be looking at the situation, looking at the circumstances. Has it always been higher? Is it getting better? Is it settling? Did it used to be a lot higher and now it's coming down, or not? Is it just staying where it is? And how much higher is it? Is it like way off, or is it just a little bit off? So that would kind of depend on what I would be advising at this stage. So if it's way off and it's always been up and it's never coming down, I guess you could talk about revision. 6 months is a little bit early, ideally 12 months, but you could talk about it at least at 6 months. Revision would involve lowering the implant, basically releasing the lower part of the capsule and lowering the implant. So sometimes you do have to lower implants, especially if they're under the muscle. That's the other thing I'll be looking at. Is it under the muscle or over the muscle? So if it's on top of the muscle, I'd be more hopeful that it might settle than if it was under the muscle. And then I would just sort of be guided. This is my personal view. If you're not my patient, then you are better, to do what your surgeon says. But in my view, I think that, you can have the conversation at 6 months, and, guided by how bothered the patient is by it, and also how bad it is. Because if it's really bad and really, asymmetrical, you might want to do something about it sooner than if it was quite a subtle difference. If it's a subtle difference, you might say, look, I don't really want to go into surgery, because obviously if you go into surgery, you can make it worse. You don't plan to make it worse, but you can introduce infection, you can lower it too much, you might not lower it enough. So there's all sorts of risks with doing surgery. So if it is going to get better on its own, you're better off waiting. So you really want to look into the history of if it's kind of improving on its own, then you might think, well, let's give it a bit of a chance. And the normal time for revision is a year. So 6 months is not normal. to do revisions unless they're way off and kind of obviously not going to settle or do anything. Then you could think about it around 6 months. But as a general term, you're looking at a year for things to kind of really start to properly settle. And there's probably still settling to be had even after the year, but it's quite a lot to make people wait for longer than a year. So yeah, I'll be guided by you as to what we do. In terms of the 6 month mark, ideally you'd wait, but if you're cheesed off with waiting and it's not improving in any way, then you could think about having a revision, talking about it. So as I say, if you're my patient, then please come and see me. I'll be happy to have a look, see where we are, perhaps have a look how it's going and make a plan if that's acceptable to you. Following a shave excision, will my mole grow back? Probably not. And this is one of the kind of things about a shave excision compared to a formal excision. So a formal excision actually cuts the whole mole out, so the whole mole gets removed. But a formal excision will leave a scar, and the scar will be a bit longer than the diameter of the mole. The shave excision gives less scarring because it just leaves sort of like a patch the size of the base of the mole. So cosmetically speaking,
if I have a skin cancer removed by your clinic, but it needs further treatment, can I then go back to the NHS? Yes, you can. So in fact, what we do...
got my cell phone. Sounds a bit arrogant the way I said yes, you can. God, not a good looking seeing yourself back. Having a bit of a nightmare with the TikTok. I don't know if you can tell, but I think it's the iPad, which is from the 80s. Resume live, resume it. So so cosmetically speaking, if your mole is suitable and it's only for raised moles that are clinically benign, that you're not worried they're cancer. If they're not raised, if they're flat, or if you think it might be a cancer, you will not be suitable for a shave excision. So there's only a group of moles that are suitable for a shave excision. So if you are suitable for a shave excision, then we can have a conversation about the pros and cons of a shave. So one of the main pros of a shave is that you're not cutting any skin out because you're just taking the bit that's raised away. So you're not distorting things, especially if it's in a tight place like around your nose or around your lip or something. But also the scarring is less because it's not a full thickness injury. It's just partial thickness, and it's just the top of the mole's taken off. So the scarring usually heals better, scarring's better. So cosmetically speaking, a shave is usually better. People do worry about that. They think they don't like the thought of that, so they will, and if you don't like the thought of it, then that's fine. But from a medical point of view, it tends not to grow back. If you have a raised benign mole, if in the next 10, 15 years, probably nothing's going to happen to it. It's probably just going to, stay the same. So if you take off the raised bit, then it's the bit that's left behind doesn't tend to grow back. All right, if you get the IT team on that, so the bit left behind doesn't tend to grow back. So so from a medical point of view, it's fine to do a shave excision, but some patients don't like the thought of a shave. They want the whole mole to be removed, which is fine. You can have the whole removed. For us, it's the same price whether you have a shave or I don't know what's going on with that. Where's the music coming from? So it's the same price. Am I going to get copyrighted for this music? Sorry, I'm not. Thank you. I'm going to turn the sound down. So yeah, for us, it's the same. Oh, flipping heck! Someone touch it. So for the same price, and it's just a question of if you fancy if you want it removed completely, the excision would be the way. But as I say, it's a scar, a bit longer than the diameter of the lesion, so it might be a bit more cosmetically obvious, but it might give you peace of mind that the whole mole's removed. So it'd be really for your benefit, your peace of mind. Unless, of course, to say we're worried about the skin cancer. But if we worried it's a skin cancer, we wouldn't give the option for a shave. You would kind of have to have an excision. So yeah, so it kind of often comes down to you in terms of whether you have a shave or an excision, if it's a suitable mole, that is. So it's a conversation to be had. And the good thing about a shave is if you're not happy with it, you could always excise it. So if it does come back, or if there's a dent or there's a problem like that, then you could always excise the residual. So you've got that option. Whereas if you have an excision and you're not happy with the scar, there's not a lot you can do. Crikey, I don't know about you, but that was stressful with all this TikTok thing going on. I'm sorry, I don't know what's going on with TikTok. I'll try and get it working on my computer if I can work out how to rotate my camera. But I better turn it off while I'm still okay on TikTok. Otherwise it's going to dump me out. And sorry, TikTok, I've given a very sporadic service to TikTok tonight, and I'm very aware of that, and I deeply apologise for that. Instagram, YouTube, and Facebook has been much more stable connection, shall we say? So yeah, let's go. That's it. We're done. So I will see you next week, and I will bid you good night. And goodness me, if you've got any questions, for goodness sake, ask them, because I've got to do this again next week. So we need some questions coming in. So bring it on. And look forward to seeing you same time, same place, 7 o'clock next Tuesday. Peace be with you. End the stream.